Early symptoms of diabetes can save your life, or prevent serious health problems. They make you informed about that you have diabetes. They can also inspire you to get your levels under control. Diabetes is a group of metabolic disorders characterized by a high blood sugar level. Over a prolonged period of time, diabetes prevents your body from properly using the energy from the food you eat. Diabetes occurs when pancreas produces little insulin or no insulin. This condition is called type 1 diabetes. Insulin is a naturally occurring hormone, which helps the body use sugar for energy. Or, the pancreas makes insulin, but the insulin doesn't work as it should. This condition is called type 2 diabetes. 9 out of 10 people with this disease have type 2 diabetes. Type 2 diabetes can be controlled with a combination of diet, weight management and exercise. So stay with us because we will give a list of foods that are toxic for diabetes and some foods that cures diabetes. So let's talk about 7 signs of diabetes. Starting from number 7. Unexplained weight loss. Unexplained weight loss is the term used to describe a decrease in body weight that occurs unintentionally and can be a warning sign of diabetes. Unexplained weight loss means weight loss without trying through dieting or exercising. This weight loss can be caused by a number of things, including depression, certain medication and diabetes. If your body can't get energy from your food, it will start burning muscle and fat for energy instead. You may lose weight, even though you haven't changed how you eat. If you have unplanned lost more than 4.5 kilograms in 10 months or less, you should consult your doctor. They will be able to determine what's causing the weight loss. 6. Fatigue. Fatigue and tired are not the same. When a person is exhausted, they usually feel better after resting. When a person has persistent fatigue, taking a rest may not relieve feelings of exhaustion and lethargy. According to the American Diabetes Association, research shows that 61% of people with newly diagnosed type 2 diabetes report fatigue as a symptom. The same study found that fatigue is the second most common symptom in this group. Diabetes can impact on a person's energy levels and cause them to feel very fatigued. This fatigue occurs as a result of insufficient sugar moving from the bloodstream into the body's cells. Your body converts the food and glucose that your cells use for energy, but your cells need insulin to take in glucose. If your body doesn't make enough or any insulin, or if your cells resist the insulin your body makes, the glucose can't get into them and you have no energy. This can make you fatigued than usual. Regular exercise, combined with a healthy diet and a good rest, can often boost your energy levels. 5. Blurry vision. Blurry vision is when it's harder to find out details in what you're seeing. An excess of sugar in the blood can damage the tiny blood vessels in the eyes, which can cause blurry vision. This blurry vision can occur in one or both of the eyes and may come and go. If a person with diabetes goes without treatment, the damage to these blood vessels can become more severe, and permanent vision loss may eventually occur. Diabetes also increases the risk of other serious vision conditions, such as cataracts and retinopathy. The retina is a group of cells on the back of your eye that take in light. They turn it into images that the optic nerve sends to your brain. Damage to small blood vessels in your retina causes diabetic retinopathy. It's related to high blood sugar levels. The longer you have diabetes, the more likely you are to get it. 4. Intense hunger. Intense hunger even after you have eaten may be a sign that your body doesn't turn food to blood sugar in the right way. Illness or certain drugs can cause it too. People with diabetes often do not get enough energy from the food they eat. The digestive system breaks food down into a simple sugar called glucose, which the body uses as fuel. In people with diabetes, not enough of this glucose moves from the bloodstream into the body's cells. As a result, people with type 2 diabetes often feel constantly hungry, regardless of how recently they have eaten. Eating a mix of protein and carbohydrates can help people with diabetes. Protein helps release the satiety hormones, while carbohydrates stimulate other necessary hormones. Protein is one of the three main energy-providing nutrients. Along with carbohydrates, it helps the body to grow new tissue, therefore helping to build muscle and repair damage to the body. Protein requires insulin for metabolism, as do carbohydrate, but has minimal effects on blood sugar levels. In well-controlled diabetes, large amounts of protein have the potential to contribute to glucose production, minimally increase blood sugar levels, and require additional small amounts of insulin. 3. Dry mouth and itchy skin. Your mouth will get dry and cracked at the corners as your body draws fluid from it. Less saliva and more sugar in your blood make infection more likely. Your gums might swell, and white patches can grow on your tongue. It can help to drink increased water, or chew sugar-free gum. Your body takes water from all over to get rid of extra blood sugar that may cause dry, itchy skin, especially on your legs, feet and hands. Without treatment, they can become bigger problems, like the loss of a foot or part of your leg. Patches of dark skin on the neck and armpit can also signify a higher risk of diabetes. These patches may feel very soft and velvety. High blood sugar levels can also affect blood circulation and damage the body's nerves. In people with type 2 diabetes, this can lead to pain or a sensation in the hands and feet. This condition is known as neuropathy. It can make it harder for you to feel cuts, wounds, or infections, and it can worsen over time and lead to more serious complications if a person does not get treatment for the diabetes. 2. Frequent urination. If you have ever think about how often you should pee on a daily basis, you're not alone. How often you urinate in the color is actually a very important sign of your overall health. A healthy person urinate anywhere from 4 to 10 times in a day. The average amount is usually between 6 and 7 times in a 24-hour period. When blood sugar levels are high, the kidneys try to remove the excess sugar by filtering it out of the blood. This can lead to a person needing to urinate more frequently, particularly at night. 1. Increased thirst. People with diabetes often feel very thirsty. This feeling can continue even if they drink plenty of fluids. To get rid of that extra sugar, your body draws water from its own tissues. The frequent urination that is necessary to remove excess sugar from the blood can result in the body losing additional water. Over time, this can cause dehydration and lead to a person feeling more thirsty than usual. So here are 2 very important videos, don't skip it. One is for foods that cause diabetes and one is for foods that cures diabetes.